Oh boy, I got a little complacent this morning. I'm a few minutes late. Today's morning medicine is Ferrum Magneticum. Sounds like a one of those superhero characters. like there is one that's Magneto or something. Ferrum magneticum, which is the lodestone, which is a naturally occurring stone that is magnetized. What's it got in it? Sequoia oxide of iron. Anyways, black oxide of iron. Kaspari, a homeopath or doctor or whatever, is the authority for ferrum magneticum. Teste, who's a great homeopath, who puts ferrum magneticum in the arnica, which is good for injuries and trauma. Group along with ledum, which is good for any bites, puncture wounds, bunch of different things, injuries. Crotum tig, what is that? That's a snake, I think. And rust tox, poison ivy, and spigelia. I don't know what spigelia is offhand, but spigelia, I think it's good for some lung stuff and that. Has had some experience with it, and it's good for psychotic constitutions, which is people who have retained. Well, let's just get the psychotic constitution up so I don't. Psychotic constitution. This is a person. Is a concept primarily used in classical homeopathy to describe a person's deep-seated physical, mental, and emotional traits. It is based on Hahnemann's theory of miasms and is generally characterized by themes of excess. So when you think of psychotic, you think of excess. When you think of Sora, you think of destruction, I'm pretty sure. Anyways, that's all deep stuff that you don't really need to get into if you want to utilize homeopathy. Excess overgrowth and fluid retention. So they'll have a lot of fluid retention, edema, they call it, and overgrowth, warts, and different things like that. Tumors, ganglion stuff. Ganglion. Now, ganglion is a basically on the foot a it's the tendon that overgrows basically. Then you get a lump there that's tender. And I had to look it up. I'm like, ganglion, that's, and I kept thinking about ganglion for my wife. She's got a small bump on the bottom of her sole in the middle of her foot that is very painful, like stepping on a stone, she says. So, and I've tried a bunch of different medicines for that, but I looked it up. I said, "Oh, ganglion. Let's look that up." And I asked Doctor Google, of course, "Can you have a ganglion on the bottom of the foot?" And it said, "Yeah, it's a tendon and all that." And I'm pretty sure that's what's going on with my wife. Her tendons inflamed, but it's a ganglion, I think, on the bottom of her foot. Looked that up on the right foot, it said, right sole of the foot, bufo, which is a poisonous frog. I don't have that, so I guess I got to order it and give it a shot for my wife's foot and see what happens. And I'm still trying to work on her legs and things. Some of the things you try to relieve, it just it can elude you. It can be like, oh man, I can't find this medicine for nothing. And so I've tried a bunch. I've gotten some relief, but it just palliates. It just makes it feel better. So you just keep trying. But most of the things, like her hernia, gone. Lycopodium got rid of that. What else did she have? Anyways, certain things just gone. Other things, it can be quite tricky. So but you can, and that's my goal with all this, is to show you how many medicines we actually have that has been proven. This one has been proven. Some of them haven't. Some of them they go by someone was poisoned by it, and this is what happened to them. And when they get poisoned and they get symptoms from that poisoning, you take those symptoms and you say that's what it'd be good for in someone who has a cold, a flu, an injury, a grief, whatever they have, and they have those symptoms and they match what happened to this person when they were poisoned by that substance, because that's basically what a proving is. We poison you with a homeopathic remedy, which can be antidoted, I want to say easily, can be antidoted anyways. So you get sick, write down the symptoms from taking the homeopathic remedy, give another homeopathic remedy like camphor or something, and it removes those symptoms. But meanwhile, you've got these symptoms that when you see that, now this is what it does in a healthy person. In a sick person, they come in and they got a lot of these symptoms, and that's what you're doing in homeopathy, is you're matching those symptoms of that sick person to the symptoms we received from a healthy person that actually took the medicine and overdosed on it. And when you see those symptoms in a person and it matches the symptoms of the proving, you give that medicine and it usually nullifies whatever's affecting that person. And then they're not sensitive now, or to the they're not susceptible to that sickness, disease, whatever it is. So Testi, who puts Ferrum metallicum in the arnica and spigelia group, and it's good for psychotic constitutions, which they fluid retention and overgrowth of things. Ferrum magneticum produces paralytic weakness, like the other iron preparation. So there's, that's a big thing. When you have a paralytic weakness of a person from whatever symptoms, whatever happened to them, you would consider these medicines. So Ferrum Magneticum, which is lodestone, naturally occurring magnetic stone. Paralytic weakness, that's a big one. Flatulence, lots of gas, and it doesn't smell well. Grumbling in the stomach, abdomen. Urgent diarrhea, so they've got to hurry up and go. Warts, this is that overgrowth. Psychotic constitution, which is the overgrowth and the fluid retention. And excessive lassitude, just totally tired, doesn't want to do anything. Uh, Modalities, worse during meals. So when they eat, things get worse. All right. Mind, they have indecision. They can't make a decision on what they want to do, which direction they want to go in life, what food they want, whatever. And long reflection on it. They just keep reflecting. They don't know. They're just indecisive. Indolence. That means they're just very mean and angry and all that kind of stuff. Slowness of movements. So they're just very slow moving, and it's probably that lassitude going on. Air of importance. Oh, I don't think that's the way you spell that air. That's the breathable air, but they have, I think it's HEIR. Anyways, of importance. So they feel above everybody, and they feel like they're self-sufficient. They don't need anybody. And there's that irascibility, which is hot temper. They just fly off the handle right away. Indolence. Well, anyways, abdomen, movements and grumbling in the stomach. So there's a lot of movements, and that's with a lot of these ferrum iron medicines. I did a bunch of iron medicines. Tomorrow's going to be Ferrum Metallicum, which is the main remedy. Ferrum Metallicum is the main one. Then you get all these other ones that they add different substances to, like Ferrum arsenicum, Ferrum aceticum, all these things. Loose stool of flatulence, especially left side with pulling in legs. So they have this flatulence and loose stool, and they have like a pain in the left side, and they get like this, feels like the legs are being pulling at the legs. Abundant flatulence with abundant and frequent flatulence. So just a lot of gas. So obviously they're having digestive problems, and that's why worse eating, because when they eat, they just get worse. Back nothing, tearing and lacination. A lot of lacination, which is like a sharp electric shock type of pain in the body. That's in the left side also of the chest. So it seems like there's a lot of left-sided stuff, left side of the pulling in the legs and the pain in the abdomen, and left side in lacinating and pain in the chest when breathing. So they take a breath and they get that lacinating, tearing pain in the left side. Sensation of emptiness in chest. You'd think that would be in the stomach, but yeah, they feel like there's an emptiness in the chest. Pulling in ears, so it feels like something's pulling in the legs, pulling in the ears, and pharynx during deglutition. Deglutition is swallowing. So they swallow, they get a pulling in the ear and pharynx. So, this could be a cold, a flu, anything like that, that they get this. And, with this laceration in the chest, these all can be flu and cold things. Itching and tingling in the ears. And you'll see there's a lot of itching with this medicine too. Darkness in the right eye, oppressive pain. So it feels like there's something pressing on the eyes, swelling of the lid, causing them to blink a lot, pricking in the eyes, and itching. There's more of that itching. Dejected look in the face with heat, followed by redness. With all this going on, they just got this dejected look like, oh man, I can't take it. Itching and tingling again in the face. Eruptions on the forehead, eyebrows, root of nose, cheeks, lips, and chin. So they got pimples. Is it pimples? It could be, different kind of eruptions. Now, they have profuse lacrimation in the eyes. So the eyes are watering. They have that oppressive pain, that pricking and itching, and the eyes are watering. And then they got eruptions all over the face, forehead, eyebrows, nose, cheeks, lips, and chin. Female, nothing. Food, nothing. Pulsative headache by fits. So the headaches just come on all of a sudden and it's pulsating, and I always ask, what's the headache feel like? Is it stabbing, throbbing, pounding? And throbbing would be the pulsating. Each one of them would lead you, throbbing would be like a belladonna, or like this one, Ferrum Magneticum. Arsenicum would be burning. Stinging would be apis. So this is how you tell the difference between the headache. And the better you do with asking that question, finding out what it feels like, where it's at in the head, because it says circumscribed, which is circular headache in the morning, generally on the right side. So this is a right-sided headache. Headache on stooping, moving arms, going upstairs. So all these things would help you to determine between a few different headache medicines, which there's probably 100 of them. But then you whittle it down by asking some of these questions. Itching in the scalp. So their scalp is itchy. Obviously, they've got a dandruff or something. And, well, they've got eruptions. So there's something going on with the scalp that they're having these itching eruptions. Small, painful. Oh, eruptions are small and painful on scalp. So these eruptions are itching and they're, just, I don't know why the head wasn't in there with the eruption. Oh, yeah, forehead. But I would think it's more on the rest of the scalp, too. And falling off of hair. So they're losing their hair. Pulsative headache. I did that. Okay. Neck. There's no heart, but neck. Pain in nape of neck in the morning as if laying in inconvenient position. So that's why I always say that pain in the neck is not always from laying the wrong way. Even though you think it is, it's from something else going on that needs to be taken care of. So you really need to pay attention to these stiff necks. Urine is red, copious, which becomes the color of clay, which is, I guess, a grayish color after standing a long time. So it's usually red, but after standing, it becomes a gray color. So that's a very interesting symptom for Ferrum Magneticum. Cramp-like or paralytic pulling in forearms and hands. And of course, you have that pulling in the legs too that they mentioned up here, or where the heck was that? Anyways, but there's a pulling, all this pulling sensation, and this one's in the forearms and the hands, and I think it was with the abdomen, yeah, especially left side with pulling in legs. So a lot of pulling in the limbs, basically. Wrist feels dislocated. So liver nothing, lungs, frequent hawking of mucus with a dry cough after dinner. So that's worse from eating, from irritation in trachea. So they have dinner, they get this dry cough, and it's from the irritation in the trachea as if swallowing dust. Acute laceration again in the knee. So there's a cutting pain in the knee. What was that laceration? Laceration. I don't think there's a laceration, but it's a, yeah, laceration in the chest. There's another one somewhere. Anyways, and lacination is like a cutting pain, basically. Gangling of foot. This was led me to look at, and that's usually on the top of the foot, a growth from the tendon. My wife's is a growth from and I didn't know if it was a tendon or a ligament down there. And I looked up a bunch of stuff, but when I looked up gangling of the foot under the sole, bufo came up, which is a poisonous frog. Tickling, prickling in the heels. I don't know if that don't sound like what do they call that? There's something when the heels are painful. I don't think it's that. But anyways, tickling and prickling in the heels, starting in the soles. I don't know what a starting. I forget what a starting is. But anyways, a lot of these things, you just know the soles have a pain. There's a tickling and a prickling in the heels. Small warts back of hands. This is that can be thusia, a few other ones. But Ferrum magneticum has that also. And that's that overgrowth from the psychotic miasm that Hahnemann talks about. Whitlow. Whitlow is a infection around the nails of the fingers or the feet. So there's anyways, a infection there that is deteriorating the skin. Dryness and tension of the hands, and little toe is painful. So it's the big toe. It's the little toe. And here's more lacination, itching, and there's itching with everything, and lacination, unscrotum, and extremity of glands. So the penis, the scrotum has this itching and lacination, like a sharp pain, cutting pain. Increased sex drive without erection, or the lack of desire, without erection, of course. But they could have that increased desire, but they don't get an erection, or they have a lack of desire. So that's not a very good symptom I would go by. Accumulation of water and saliva. So the mouth is always watering, almost like they want to throw up. I don't know if there's nausea. Abdomen didn't say nausea. Nope. But they just a lot of watering of the mouth and saliva. That sounds like mercury. Mercury always has a lot of watery saliva. Itching. There's more itching in posterior palate. So the roof of the mouth. You'll hear someone going and clucking their mouth, trying to scratch that with their tongue. I don't know if you ever. I know I've had one time I do remember trying to scratch the top of my mouth because it was itchy. So, and that could come from nose stuff, sneezing with stoppage of one nostril, and catarrh. So they got a lot of sneezing. It doesn't say from itching up there, but I'm sure there's something going on with that sneezing, that they have like an itching or something. And then one of the nose stops, with a bunch of thick mucus, which is what catarrh is. Urgent want to evacuate, have a stool with lots of flatus and small liquid. So they feel like they have to go, then they farting basically, and they a little bit of liquid comes out with them farts. Itching, shooting in anus. There's more itching. Tickling and itching in rectum. So there's just a lot of itching and tickling in everything in this medicine. Itching and tingling again in different parts of the body, especially in the evening. So yeah, mitigated by scratching. So it's better by scratching. Now, I think sulfur has that itching at night, getting in bed, and when they scratch, it burns, but appears in other parts. So he scratches the part that's itchy, then it pops up in another part. So you would think of Ferrum magneticum. Red spots on the skin, bright red or bluish red. They disappear with pressure. So they get this red spot, they push on it, it goes away. Then it comes back, I would imagine, when you let go. Small warts on hands. That's definitely like thusia and a few other ones with that psychotic miasm, which thusia is one of the main remedies for that psychotic miasm. Sleepy on sitting or lying down. So as soon as their butt hits the chair or they lay in a bed, they're sleepy. Yawning, major amount of yawning. Absurd dreams with weakness on rising. So they have these dreams all night. most likely is disrupting their sleep, and they wake up weak at night, and they want when they get up, and they want to, they want to stay in bed basically. Flatulence during a meal, so that meal, like I said, is always aggravating. Worse during meal. Uh, Pain in epigastrium. I don't know if that's during a meal, but they always have that pain there, especially on breathing. So there's that breathing. They breathe, and the lungs, where is that? They breathe, oh, maybe it's the chest. Tearing when breathing, tearing and laceration in left sided chest when breathing, and pain in the epigastrium, which is the upper part of the stomach, especially on breathing. So the chest, uh, and the stomach get that pain on breathing. Chest. It is a lacerating and tearing pain in the chest, and it just says pain. It's probably a lacerating, tearing pain also. Let's see, painful during the teeth are painful during mastication or chewing, and they have bleeding gums when pressed on. So when their gums get touched by anything, especially I would imagine brushing their teeth, they have bleeding. You might consider one of the medicines as Ferrum Magneticum for that. They have shivering heat, shivering. They shiver. Then they have heat with catarrh, with the mucus coming out. They have heat. Pulse is slow. Perspiration on any exercise. Anytime they get any exercise, it doesn't have to be much. They perspire, and it smells like acid. Interesting. Acid might be acrid. Anyways, measles, good for measles. Sweat in the morning, body and occiput. So I've got, this is one of the Ferrometallicum would be one of the measles. I just heard that Utah is having a major outbreak of measles. I also have morbillinum, it's called, which is the measles nosode that you could give to everybody to kind of prepare them for that measles coming into their area. And then you can consider medicines like Ferromagneticum and a few others. These vaccines and that have been suppressing a lot of these diseases, and if they remove the vaccinations from people aren't taking them, they're going to start getting these diseases. And being that they have not fought off any of these diseases, their immune system or their vital forces become weak to fight these things. But if they do get these things, homeopaths can come in and relieve the problem relatively quick. Measles wouldn't be a hard thing for homeopaths at all. In her throat, they have a bitter, rancid taste in pharynx on hawking mucus. So it's bitter, rancid tasting hawking. Lacinations again in the throat, which is cutting pain. And they have pressure in the esophagus as if too much was swallowed at one time. So there's, this can be in colds, flus, different things like that. Could be in measles that they have. I don't know. I'd have to see what the measles symptoms are, but they could have this problem with their swallowing. It feels like they just swallowed too much food, even if they haven't. All right. How much time's left? Okay, I'm good. Ferrum magneticum relieved after spigelia. So he mentioned those few medicines, and that's surprising to me that some of these are in that same realm as Ferrum magneticum, Arnica ledum, Crotum tig, Rust tox, and spigelia. So he gave spigelia. It didn't do nothing, but Ferrum magneticum relieved in an old man suffering from chronic rheumatism of the nape of the neck. So there's that nape of the neck. He's just got like a pain, rheumatic pain up in the neck with irritable disposition. So he's looking at it. He's like, okay, this sounds like spigelia. And this is what will happen a lot. That's why you get someone that says, hey, I got this problem, and you give them a medicine and it's not the right one because, I mean, it's an art. We've got science behind us, but there's an art to figuring out what actual medicine that person needs. You have to take a case. You have to get into what the actual problem is. It can be quite. It can be tough sometimes, but you'll get into that realm where you have arnica, spigelia, rust tox, and a few other ones, and ferrum magneticum, and you're considering which one is this, and there's so many different symptoms that are similar there, and you're not quite getting the right thing. So you give spigelia. Well, that didn't work. Okay. It may even relieve it. It may even palliate the whole pain or whatever's going on. And then you remove that medicine like spigelia, and that didn't relieve. That didn't cure basically. Then you go to the next one. He went to Ferrum Magneticum, and that guy's pain in the nape of the neck and his irritable disposition was relieved. Gone basically. Also, a case of compound capsular cataracts in a gouty patient. So this patient has tendon growths and things like that. They're gouty, and they have cataracts. A third, he used Ferrum Magneticum, and it relieved that cataracts and that gouty stuff. A third patient had rheumatism of both thighs coming on after violent exercise. So he exercised a lot and his thighs were so painful. This patient was treated in 2 attacks. So the first attack, he received arnica. So that, and that makes sense. You got this, you exercised, you injured yourself. Injuries always, arnica's great. First. And then Ferrum Magneticum. Okay, so he gave arnica first, and that obviously didn't do it. So then he gave Ferrum Magneticum, and that did the trick. In the second case, Ferrum Magneticum was given at once. So he had this person that exercised, had pains in their legs. He just went right to Ferrum Magneticum, and the effect was speedily and marked. So it just like relieved it like that. And I'm telling you, when you give the right medicine to somebody, it's like night and day. The person just, I always remember my wife's headache, man. And it was like, I took 10 Tylenol PM Sal and I can't get rid of it. I just got home from work. I'm like, oh man, all right. What's it feel like? Stinging, stabbing, burning, throbbing, pounding, burning. Burning's arsenicum. Could be causticum, but arsenicum. Gave it to her, went up and took a shower, came down. She's on the phone like nothing happened. You know, that's how amazing it can be when you give the right medicine. So he, like he said, at Ferromagneticum was given, and at once, and the effect was speedy and marked. The fourth patient has a very unpleasant experience with the medicine. Now, I think this guy is a hypersensitive person. He suffered from mercurial neurosis. So, in that time of the medical history, they were given a lot of mercury. Mercurial neurosis is like, a neurotic mind thing that's going on from taking too much mercury. I don't know what they were giving it to him for, but and was very sensitive to medicine. So that's why I say he's a hypersensitive. So you have someone has a lot of allergies, or they're just, yeah, they're just hypersensitive to the wind, the blow, whatever. You want to take your medicines, you know, um, and give it in water first off, and now you may have to dilute it out a couple times in water to uh, make it more mild, so it's like this. You give the pill, it's like hitting them with a hammer, bam, that shock goes in and can heal, and it also can aggravate. The other way is you put it into water, and that's like a tap, like, hey, vital force, wake up, you got to fix this situation. So you can keep tapping and tapping and tapping, and that's, I give everything I got in water. If I'm giving the medicine to my family members, it goes right into water. Two things you can do there. Number one, you can adjust the dose. So I can tell you to take it every 15 minutes, pound it 10 times. I usually put it in water and pound it 100 times, unless I know this person has a lot of allergies and are hypersensitive. Then I pound it a couple times and give it to them. I'll pound it 100 times, put it in that water, tell them, take a sip, small sip, and every time you pound it, take another little sip, take another little sip, take another little sip, and pound it 10 times every time. Eventually they say, hey, I'm feeling better. And if they do say, I'm getting aggravated from this, or, oh man, it got worse, then you back off. I can back off of giving them that much. I can dilute it out in more water if they get aggravated right away, if they're hypersensitive. But putting it in water, we're not, 80, 90% of water? That water going in is much, um, I think it's much more effective. And that's where Hahnemann was. In his last experiments, he was giving every LMs he was working on. One of the symptoms which led to his being given was a painful contraction of the posterior cervical muscles, the neck muscles, against which no remedy testy, a homeopath, had produced any effect. Ferrum magneticum, 4 globules, those little sugar tablets, in a tumbler of water. 2 teaspoonfuls every day was a prescription. The first teaspoonful was which was taken in the morning, seemed to produce a sensible improvement. So he's doing better. A quarter of an hour after the second dose, which was taken at 4 p.m., the sight became dim. So now he's basically, this is at cataracts. He's proving the medicine. He's getting an aggravation from it. A halo of fire red violet was seen in front of the right eye and afterwards in front of the left eye. Soon after, this halo, which formed a circular zigzag shaped line between narrow and narrow. So his vision's going. Finally produced such a complete blindness that the patient assured Testy he was unable to distinguish night from daylight. This lasted 1 hour and did not pass off entirely until after a meal. That's why I say you can antidote it. He probably antidoted it with a meal. Much more distressing phenomena followed. Toward 8 p.m., the pain in the nape of the neck, which first was seated in the left side, passed to the right, invading the whole extent of the trapezoid muscle, which it became literally frightful. For 2 days and nights, the patient, who was a brave, strong man whom I had seen bear the most painful surgical operations without uttering a sign, suffered to such an extent that he uttered heart-rending cries. Now, this is just from that medicine. Camphor, pulsatilla, and bryonia failed to relieve this whole situation. He was trying to antidote it. The first rather aggravated, so camphor aggravated. Rust tox effected some relief, but it did not prevent the reoccurrence for 8 days in succession of this visual phenomena, though with less intensity than the first time, at irregular intervals, generally 6 or 7 a.m., and sometimes even at night in perfect darkness. So that just goes to show how powerful these medicines are, and you really do need to be careful. If you're giving medicines, you've got to know. You know, you're not going to harm somebody. I don't know what potency was given. Doesn't say. He was probably at that time they were given like LM, or I mean 1 M's, 10 M's, 50 M's. So undoubtedly he gave too high of a dose. If you would have given a 6C or something, that would have been, and in water you would have just gradually increased until he got cured. He undoubtedly, I guarantee, a test he gave him a 10M or a 1M, a 10M, a 50M, something too high. Even though it was in water, when you give it that high, you'll get that kind of a result. So that goes to show how powerful these medicines are. That's why I always start out, usually I do a 30 or a 200C. And from there, I can adjust. I can go back to a 6C. If I give a 30 and it helps, but it doesn't help enough, you can go up to a 200C. If it aggravates at a 30, you can go down to a 6C. So if you go to a 50M, this is what it might happen. This guy will be sick for a while, and you'll try antidoting it with everything, and it won't work. Hopefully, finally, this thing will wear off on this, had worn off on this guy. But you got to be careful. Some of these medicines are powerful. That's why you always start small and slow, and you work your way up. You don't go with high doses because that aggravation, people don't need that. And that's the way they were doing it when they first started. They were given high doses, aggravating the crap out of a person. When they would come back, they'd be a little better. They were sick here, and when they hit them real high and they come down, now they're only this sick, but they still have the sickness. Then you hit them again. I don't know who would want to go through that. With a lower dose, they're sick here, you hit them, you hit them, you hit them, you hit them, you're bringing them up, bringing them up, bringing them up, and they get relief. So that's the way it should be done. All right, that is Ferrum Magneticum, lodestone, naturally occurring magnetic stone, and that is morning medicine. Tomorrow's Ferrum Metallicum. That's a big one. That's going to be, that's like the main remedy. And then from there, they made all these other ones. Of course, lodestone's a little different, but you know, they would add arsenicum, they would add sulfur, arsenic, all these different medicines to the Ferrum Metallicum to get different responses. So that is morning medicine. You can age, but you don't have to get old. Depends on what you do for yourself, how you treat yourself, and your stress levels. I'm going to level